So today we're going to examine the hip flexion. So hip flexion, the range of movement of hip flexion is 0 to 90 degree. In some it even goes to 0 to 120. The muscles which are involved in hip flexion are the iliopsoas, which is the iliacus and the psoas major muscle. The psoas and the myotome for these two muscles are basically the L2 to L4. The psoas major is arising from the vertebral process, the transverse processes of L1 to L5 and the vertebral process of T5 to T12, and goes to insert on the femur on the lesser trochanter. The psoas, the iliacus arises from the inner lip of the iliac crest and the upper border of the inner lip of the iliac crest, okay, and it gets to go and insert on the lesser trochanter of the femur. So now how we're going to describe test as per the MRC grading for the hip flexion. So first you ask the patient, as shown, to sit in the on the sitting position. We're going to test the grade 3. That means we do not give any resistance to the flexion of the hip. We ask the patient to lift as much he can, supporting this table, and see how much degree of movement he can do. That means it's against the gravity. That means we can go, it's a grade 3, it's fairly fine. Now we want to test whether it's a grade 5, grade 4. Okay, so we give him resistance, asking the patient again to flex the hip and feel how much he can do. So now in grade 5 he will be able to go to the maximal range of movement even after giving resistance. So that means there's a very good outcome. But if he's able to do the flexion, but somewhere in between you feel he's not able to do it terminally against the resistance, that will be a grade 4. Now coming to grade, now if the patient is not able to do in this position to flex the hip, when we have to assume that you have to eliminate the gravity. So as a rule, gravity elimination means it has to be parallel to the ground. So we'll ask the patient to lie down, supine, okay. The gravity is eliminated. We support the limb, okay, we abduct, and we ask the patient to flex the knee to the hip and feel for the how if he's able to do this. If he's able to do this means it has a grade 2 power. Okay. Now for grade 2, now if grade 2 is not there, he's not able to do it actively, when you have to do passively, which leaves you with grade 1 and grade 0. So you ask the patient to lie down supine. Okay. So now what we do is we're gonna so now in grade 1 means flicker of contraction, in grade 2 and grade 0 will be no contraction at all. So where do you feel the contraction for the iliopsoas? Given it's attached, the tendon is attached on the lesser trochanter of the femur, is we feel around the inguinal ligament for any palpation or contraction. So we ask the patient, so we passively flex the hip towards the chest, feeling for the contraction. If there is a contraction, that means it's grade 1. If there is no contraction, that means it's grade 0. So that completes our test on hip flexors. Demonstrate that to test a muscle which is involved in the hip flexion, abduction, and external rotation. Given that the muscle crosses both joints, it is of sartorius, it crosses the hip and the knee joint. The myotome of this muscle is L2 to L3. Origin of the muscle of the sartorius arises from the ASIS, the anterior superior iliac spine, and goes to insert as a pes anselinus on the medial side of the tibia, the proximal tibia. So how are we going to demonstrate the hip flexion, abduction, and external rotation in patients? Starting again with grade 3, is we're going to ask, we're going to examine the left side. So we ask the patient to lift. Okay, this is how it's supposed to be grade 3 completely. But it involves the hip flexion, the external rotation, and the abduction. Okay. If the patient is able to do this, the next step would be going to grade 5. Grade 5 is one hand stabilize the medial side of the ankle, okay, to resist any rotation movement. Give a resistance, okay, on the lateral aspect of the thigh. Ask the patient to do the same movement, but this time against maximal resistance, okay. So feel. If it has a good power, if he's able to do complete range of movement, it will be grade 5. If he's not able to do the full range of movement, it will be grade 4. Now if the patient is not able to do this movement, we'll have to eliminate the gravity, going to grade 2. So grade 2 will ask him to be on the supine. Now how do we examine the sartorius in the supine position with gravity eliminated? We ask the affected limb is placed on the shin. Okay? So we ask the patient to slide up his foot on along the shin of the tibia. If he completes the movement, that would be grade 2. Now for grade 1 and grade 0, we do the same thing. The patient tries to attempt but now where do you feel for the muscle? Because you have to feel for the contraction. Usually since the muscle crosses, we can either feel on the medial side of the thigh, or some examiner prefer to do it below the ASIS. So palpate for the ASIS, just below the ASIS. Ask the patient to please try to lift. As he is able to try to lift against the shin, you feel for the contraction just below the ASIS or on the medial side of the thigh to see if any contraction or not is there. If no contraction, it is grade 0. If it's some flicker of contraction, it's grade 1. Thank you. Test for the hip extension. The muscles involved in the hip extension. So hip extension range of movement is 0 to 15 degrees. Some authors even quote as 0 to 5 degrees. What are the muscles involved in the hip extension? It will be involving the gluteus maximus, the semitendinosus, the semimembranous, and the biceps. So these three muscles will form part of your hamstring. So now the nerve supply to these muscles will be your myotome will be your L5 to S2. Your inferior gluteal nerve supplying your gluteus maximus, and your tibial part of the sciatic nerve, the L5 to S2, will be supplying your semitendinosus, semimembranosus. The origin and insertion of the gluteus maximum will be from the 7, classically it comes the 7 origins, from the iliac crest, from the coccyx, from the sacrotuberous ligament, and we'll be going to insert on your gluteal tuberosity. Whereas with semitendinosus, semimembranosus, and biceps will be arising from your ischial tuberosity. And while the biceps goes and attach on the fibula on the lateral side, the semiti and the semimembranosus will be going to attach on the medial corner of the tibia as a Pesant's area. So now, how are we going to examine starting from the grade 3? So grade 3 is no resistance, asking the patient to complete the range of movement. So patient is lying prone with the hands over the head, and ask him to lift his without bending the knee. Very important to instruct the patient not to bend the knee, to ask to lift the leg from the table. Yeah, and this will be your grade 3. Now, given that he has done grade 3, the same thing is that I'm going to use my hand and apply on the posterior aspect of the thigh, and ask him to lift the leg. Yes. So what will be, if he holds the position with maximal resistance, will be grade 5. Whereas the grade 1 will be in between grade 3 and grade 5, where he's not able to complete the full range of movement, and despite giving the resistance. Now, given the patient, if the patient is not able to do this, that means we have to do the grade 2. How do we do the grade 2? You ask the patient to lie on the lateral position. Lying on the lateral position, again making sure he doesn't bend the knee. One hand stabilizes the ASIS. One is on the distal aspect around the ankle. Ask the patient in this position to bring his leg towards you without bending the knee. If he completes this range of movement without bending the knee, that will be grade 2. Now for grade 1 and grade 0 is again you put the patient in the prone position. Just could you please put in the prone position. Now you have to feel for your muscle. Now for the gluteus maximus, the area to palpate is in the center of the buttocks. Whereas the semiti and the semimembranous will be, you can palpate for the contraction at the ischial tuberosity. So your body elbow will be your ischial tuberosity, whereas the gluteus maximus will be somewhere around the center of the buttock. So feel for this, and again ask the patient to try to lift the leg again. Okay, and then as you can see in grade 2 and grade 1 and grade 0, you can, if grade 1 you will feel the contraction of the muscle, in grade 0 no contraction of the muscle will be felt and palpate. Yes, thank you. We're going to examine the muscles as per the MRC grading for the hip abduction. The range of movements for the hip abduction is 0 to 45 degrees. What are the muscles involved in the hip abduction? We have the gluteus medius and the gluteus minimus. Both arise from the ilium and goes and attach at the greater trochanter of the femur. So the myotome of the hip abduction is based on the superior gluteal nerve, which is your L4, L5, and S1 myotome. So how to test? First we start with the grade 3. We ask the patient to lie down in the lateral position and with the affected leg upwards. Okay. When we feel for the greater trochanter, okay, we feel for the greater trochanter just proximal to the greater trochanter. So before the insertion of the muscle, you feel for the muscle and you ask the patient to lift his leg towards the roof. If he's able to do the full range of movement, that means it indicates a grade 3. Now how we're going to do is, the next step is a grade 5 or the grade 4. Now based on what, we have two lever arm, so we have to give a resistance. So where do you give the resistance? In grade 5 you want a longer lever arm to test, so you can give a resistance at the ankle, and ask the patient to, and feeling again for the muscle, okay, ask the patient to lift the leg, yeah, against the resistance, okay, gives the maximum resistance. If he is able to maintain the position with the maximum resistance, the grade 5. Now in the grade 4, you give the resistance at the knee, you shorten the lever arm. Again, ask the patient to lift the leg towards the roof. Okay, that will be a grade 4. Okay, so that's how you differentiate the grade 5 and grade 4. Now coming to the grade 2, you ask the patient to lie supine. Could you please lie supine, please? Yes. So grade 2 supine. So with the leg, hip extended, knee extended. Hip extended, knee extended as the GT, feel for the GT again proximal to the insertion of the muscle. Lift the leg slightly above the couch and try to bring it outside. Ask him to bring the leg towards me. So if he's able to do it, it's a grade 2. Now in the grade 1 and grade 0, you have to feel for the contraction whether it's there or not. If it's not there, it's 0. If it's where, it is 1. Again, feel again for the proximal insertion of the muscle, and ask him to try to again lift the legs slightly above the couch to decrease the friction, and ask him to try to bring the leg out to me, feeling for the contraction. If it is there, it will be grade 1. If it's not there, it's grade 0. That's it. Thank you. So we're going to again part of the hip abduction, but this one is an accessory muscle which is also involved in the hip abduction and the hip flexion. It is known as the tensor fasciae lata. It is supplied by the superior gluteal nerve, which is the L4, L5, and S1. The origin of the origin of the muscle is again from the iliac crest, and it will go and insert in the. It will blend with your iliotibial band tract. So in this, how we're going to place the position of the patient. The grade 3 is you extend the knee in about 45 degrees of the hip with the affected limb on the couch. We ask the patient this time and feel for the again on the where it blends with the iliotibial band on the anterolateral aspect of the thigh, proximally feel for the muscle, and ask him to bring the leg towards the roof about 30 degrees of motion. This will be your grade 3 if he's able to do this. Now for grade 5, the same thing is done. You give a resistance on the distal aspect of the knee, okay, and ask him to lift up the leg. Could you please lift the leg? This will be your grade 5, okay. Or if he holds his position maximally with a lift up. If he is able to, could you lift it up, please? Yeah. If he is able to hold that position with maximal resistance, that will be grade 5. Okay. Anything in between will be your grade 4. Now coming to the grade 2 now, ask the patient to sit with the ask the patient to sit, catch the hand with one hand on the ankle, feel for the anterolateral aspect of the thigh where it blends with the iliotibial band, and ask the patient to bring the leg out towards me. Okay, feel for the contraction of the muscle. If he's able to do this, it's a grade 2. Now for the grade 1 and the grade 0 is this time you don't hold the ankle, you feel for the two area. One is the anterolateral aspect of the thigh where it blends the iliotibial band, and one is the distal aspect of the thigh on the lateral surface where the IT band is. And ask the patient to try to bring the leg out and try to feel for the contraction of the muscle. And if you get good contraction, it's a grade 1 power. If it's not, it's a grade 0. Thank you. To examine the hip adduction, the adductors of the hip, the power of the adductors of the hip. So the adduction, the range of motion of the hip adduction is 0 to 20 degrees. The hip adduction, the muscles responsible for the hip adduction are your adductors, which are the adductor magnus, the adductor longus, the adductor brevis, including the pectineus and the gracilis. The word muscles, as a rule, they arise from the pubis, except for the adductor magnus, along with the pubis, arises from the ischial tuberosity, and all of them will go and insert on the linea aspera on the femur. So the nerve supply of this will be the myotome will be L2, L3, L4, the obturator nerve, and a special mention for the adductor magnus, which is dually supplied by the obturator nerve and the tibial, the sciatic nerve. So now. So how do you examine? So first, the affected limb of the patient should be placed on the table. Okay. So suppose in this patient we have the affected limb is on the right side. His affected limb will be rested on the table. Cradle the limb. Okay. Cradle the limb like this, and ask the patient to bring the lower limb up towards the roof. Could you bring the lower limb up to the roof and feel on the knee? Okay. So this will be So if he's able to do this, that means it's a grade 3. Okay. Now for the grade 5 is I'm going to give a resistance, okay, on the distal aspect of the femur, and ask him to, on the medial side, and ask him to bring the limb up. Okay, and if he's able to do this, maintaining the maximum position with the maximum resistance, it will be the grade 5. Okay. Now if the patient is not able to do this, we have grade 2. So the grade 2 is asking the patient to be in the supine position. So as you know, it's on the adductors on the medial side. You hold the ankle slightly above the couch. You place your hand on the proximal anterior aspect of the thigh. On the anterior medial aspect of the thigh, you ask the patient to bring his leg inside. Try to bring your leg inside. So feel for the contraction. If he's able to do this, what will be grade 2? The same thing. Now if it's in grade 1 and grade 0, to feel for the contraction, it is on the proximal aspect of the anterior medial aspect of the thigh, where your adductors are. You ask the patient to try to bring his leg inside and feel for the contraction of the muscle. If there's a contraction, it's a grade 1. If there's no contraction, it will be grade 0. Thank you. So we're going to test the hip external rotators of the hip, the muscles which are involved in the external rotation of the hip. The range of motion for the external rotation would be 0 to 45 degrees. What are the muscles involved in the hip external rotation would be basically your short external rotators, which are involved the obturator internus, the obturator externus, the piriformis, the piriformis when you have the quadratus femoris, as well as your gemellus superior, your gemellus inferior, and the gluteus maximus, which are involved in your external rotation of the hip. As a rule, most of the muscles will be inserting on the greater trochanter. And the nerve supplies, the myotome, as a rule, will be mostly examining the L5 to the S1, except the piriformis, which is supplied by the S1 as the S2, and the obturator externus as the L3 and the L4. So in this, there are a few things which you need to know. Is the examiner should be sitting by the side of the patient. Okay. And in this test, which is different from the ovals, is that you already put the position of the limb in the desired position to avoid any confusion and involving over muscle like the sartorius in the movement. So first, we're going to do the external rotation. External rotation means your leg will be going inwards, so that your hip goes outwards. So you already put the patient in the desired position. Okay. If he's able to maintain this, that will be a grade 3. Okay. Because you have taken from the neutral to the desired position. And if he's holding in this, what is a info for grade 3. Now going grade 3 and above, now we go to grade 5. Grade 5 is to give one counter pressure on the arterial aspect of the thigh, of the femur. One, you hold the ankle. You ask the patient that you're gonna, don't allow me to bring your leg out. Okay. So I'll try to bring his leg out while he gives me a resistance. Okay. He'll give it, my force will be directed towards bringing his leg out, but why he's giving me resistance. And if he's able to do this, that is a good grade, that is a grade 5, okay? And he's holding in the maximum desired position. Now if he's not able to do this, if in your grade 3 is not able to maintain the external rotation, we proceed to the grade 2, which means in examining the patient in the supine position. You feel? Now in the supine position, as I said, you palpate for the GT, the greater trochanter, where most of the short external rotators will be inserting. At the same time, you bring the leg in the internal rotation, okay, like as shown. Now you ask the patient to roll out his leg and bring it outwards, feeling for them. Now, if he's able to do this movement from the internal to the external rotation, which is a grade with the gravity eliminated. Now the grade 1 and the grade 0, again the same thing, you put the limb in the internal rotation, feel for the contraction of the motor at the greater trochanter, and ask him to try to bring outwards the limb, feeling for the contraction. If the contraction means it's a good, it means the grade 1, if there's no contraction, it would be grade 0. Yeah. Thank you. To test the internal rotators of the hip, the three main muscles which are involved in the internal rotation of the hip are the gluteus medius, the gluteus minimus, and the tensor fasciae lata. These three muscles, we have described the origin and insertion previously. The myotome here is the L4, L5, and S1. The two gluteus medius and minimus will be attaching on the greater trochanter of the femur, whereas the tensor fasciae lata will blend the iliotibial band tract, which will go distally along the thigh. So in this, again the same, you have to sit, okay? The position of the examiner is sitting. We assume that the affected side on the right. We're trying to test on the right side, the internal rotator of the right side. So here again we put the position of the limb in the desired end position. We don't ask the patient to do the movement. So in hip internal rotation means you have to put the leg in the outwards. Okay. So you put in the maximum outwards. Okay. So if he's able to hold this position as shown, it must be good grade 3. We can proceed to grade 5 now. Now when we proceed to grade 5 is one hand on the medial aspect of the thigh, okay, and one hand holding the ankle. We ask the patient to try to bring his leg out more. That means internally rotate more. But we give a resistance to it. Okay? So that means it's a good grade of power. It means the grade 5. Okay? Fine. Now but if you're not able to do in grade 3, if he's not able to maintain without the resistance of position, we have to put it in, you have to eliminate the gravity. That means we put him on the supine position. So putting on the supine position, now put the patient in the supine position, palpate for the greater trochanter, where the attachment of the gluteus medius and minimus will be there. You ask the patient in a neutral position, try to bring the leg internally, what you can here, and feel if he's able to do this movement, that would be grade 2. In case the patient is not able to do the same thing, now this turn time, you put one on the GT, on the greater trochanter, and one on the distal aspect of the thigh, on the lateral aspect, where the IT band will be there. After the tensor fascial lata blends with the IT band. And all the same, the patient to try to internally rotate the limb and feel for the contraction of the muscle. If there's a contraction of any one of the muscle, it will be grade 1. If it's not, it is a grade 0. Thank you.